Morning. Today I am going to do bilateral PRS injections to the knees of a patient. The patient is 64 years old. He has been complaining of knee pain for about 2 years. Pain has gotten worse over the last 6 months. He has tried a steroid injection which seemed to work for some time, but the pain has again come back. So his son, while doing online search, located me, and he found out that I am offering PRS injections as opposed to PRP injections. They also consulted with other doctors who offered PRP injection and radio frequency ablation, or ablation of the nerves to the knee, destruction of the nerves to the knee. But they were not convinced, because it is known that ablation of the nerves, the genicular nerves to the knee, gives only short-lived benefit. It does not address the basic problem. The son told me that he was afraid that destruction of the nerves, whether temporary or permanent, could result in damage to the knee joint itself. It is a theoretical fact that any nerve destruction can long term lead to damage of a joint. For example, there is a condition known as Charcot's joint, which is a neuropathic joint. In other words, it is seen in diabetics, earlier in patients with tabes dorsalis, where the nerve fibers from the joint were not working. The joint went into a state of advanced degeneration. The patient had no proprioceptive sensation, that is, sense of position, touch, and pain. So this is a theoretical consideration with radio frequency ablation, which some pain physicians in the country are offering. And they combine it with PRP. We don't know what is working, whether PRP is working, whether they are giving high dose PRP. Radio frequency ablation, the effects are short-lived. One may have to repeat it. I prefer to go the regenerative way or the orthobiologic way, and I am going to do PRS injections into both knees. I will be using high concentration platelet rich plasma, adipose tissue derived medicinal signaling cells, or MSCs. These were formerly known as stem cells or MSCs, but the correct name is medicinal signaling cells. These cells don't have any stemness. I obtain these cells from fat because fat is a richer source of these cells when compared to bone marrow. It has 500 times more cells than bone marrow. I will also be using bone marrow to target certain areas in the knee. In future, I will be using Nanofat or micronized fat to give longer lasting benefits. As it is, the results of this treatment last for from 2 years to 10 years. There is some all evidence, and which is growing, that nanofat may give better result, but it theoretically gives better result because it has got a high concentration of stromal vascular fraction growth factors. So we'll be doing that shortly. Stay tuned to this channel, Madras Joint Replacement Center, for updates on further advances in regenerative medicine.